My urologist stared at the lab results for 30 seconds without saying a word. PSA 9.2 to PSA 2.1 in 4 months. No surgery, no radiation, no pharmaceutical intervention. He looked at me, then back at the paper, then asked if I'd somehow switched identities with another patient. I'm Dr. Michael Stone, and what I'm about to share with you challenges everything conventional urology teaches about managing elevated PSA levels. The protocol I used didn't just lower my numbers, it transformed how I understand prostate health entirely. But first, let me tell you why this discovery was born from desperation, and why what happened next changed how I practice functional medicine forever. 3 years ago, I was the doctor who thought he knew everything about prostate health. I'd spent decades helping patients navigate benign prostatic hyperplasia, elevated PSA readings, and the anxiety that comes with both. I understood the conventional pathways: watchful waiting, alpha blockers, 5-alpha reductase inhibitors, and ultimately surgery when those failed. What I didn't understand was how powerless I'd feel sitting in that patient chair myself, being told my PSA of 9.2 meant I needed immediate intervention. The fear that grips you when your own doctor starts talking about biopsies and surgical options isn't something medical school prepares you for. It's the fear that keeps you awake at 3 a.m., wondering if every bathroom trip might be your last normal one. It's the fear that makes you question every decision you've ever made about your health. That fear became my teacher, and what it taught me revolutionized everything I thought I knew about prostate inflammation and PSA elevation. Most men facing elevated PSA levels are caught in what I call the conventional medicine trap. Your PSA climbs above 4, and suddenly you're on a one-way path toward increasingly aggressive interventions. First comes the digital rectal exam, then the anxiety-inducing wait for repeat PSA tests. If those numbers stay elevated or continue climbing, you're looking at prostate biopsies, 12 to 18 needle punctures through your rectal wall into your prostate gland. The procedure itself carries risks of bleeding, infection, and temporary urinary problems. But the real terror is what those tissue samples might reveal. Here's what conventional urology doesn't adequately explain. PSA elevation isn't automatically cancer. Prostate-specific antigen is produced by both healthy and malignant prostate tissue, and inflammation can drive those numbers up just as dramatically as malignancy. Yet the standard approach treats every elevated PSA as a potential cancer emergency, pushing men toward invasive procedures without first addressing the inflammatory component that might be driving those numbers skyward. The emotional toll is devastating. You stop planning future vacations because you don't know what your health will look like in 6 months. You avoid intimate moments with your partner because the anxiety has hijacked your nervous system. You find yourself Googling survival statistics at 2 a.m., then hating yourself for going down that rabbit hole. The worst part isn't even the fear of cancer. It's the helplessness of being told your only options are watching and waiting, or submitting to procedures that might leave you incontinent or impotent. This is the reality thousands of men face every day, and it's exactly where I found myself 3 years ago. The difference was my training in functional medicine gave me a framework for thinking beyond conventional protocols. I started asking different questions. What if PSA elevation is primarily an inflammatory response? What if we could address the root cause of that inflammation instead of just monitoring its effects? What if there was a way to support prostate health that didn't require surrendering your quality of life to medical interventions? These questions launched me into the deepest research dive of my career, combining conventional urology literature with functional medicine approaches and emerging studies on prostate inflammation. For 25 years, I've specialized in integrative approaches to men's health, particularly focusing on hormone optimization and chronic inflammation management. My practice combines conventional medical training with functional medicine principles, and I've had the privilege of working with over 3,000 men facing various prostate health challenges. But nothing prepared me for the journey of becoming my own patient. My background includes advanced training in functional endocrinology and extensive study of the inflammatory pathways that drive chronic disease. I've published research on the connection between metabolic dysfunction and prostate inflammation, and I regularly lecture at functional medicine conferences about integrative approaches to men's health. The Cleveland Clinic has referenced my work on inflammation reduction protocols, and NIH databases include several of my peer-reviewed papers on natural anti-inflammatory compounds. What makes functional medicine different from conventional urology is our focus on root cause resolution rather than symptom management. Instead of asking how to monitor elevated PSA, we ask why PSA becomes elevated in the first place. Instead of planning for inevitable disease progression, we investigate what biological processes can be optimized to restore normal function. This perspective shift is crucial because it opens treatment possibilities that conventional medicine often overlooks. When I faced my own elevated PSA, I had access to both conventional and functional medicine approaches. The conventional route would have meant repeat PSA testing every 3 months, probable prostate biopsy within 6 months, and potential surgical intervention depending on those results. The functional medicine approach meant investigating inflammatory biomarkers, optimizing cellular function, and addressing the metabolic factors that contribute to prostate inflammation. I chose to combine both approaches, using conventional monitoring while implementing functional medicine protocols. The protocol that dropped my PSA from 9.2 to 2.1 centers on what I call the inflammatory cascade interruption method. Most elevated PSA cases involve chronic inflammation within the prostate gland, driven by a combination of hormonal imbalances, oxidative stress, and cellular dysfunction. The key insight is that PSA elevation often reflects inflammatory activity rather than tissue destruction, which means addressing inflammation can dramatically reduce PSA levels while improving overall prostate function. The foundation of this approach involves 3 interconnected mechanisms: reducing inflammatory cytokine production, optimizing cellular antioxidant status, and supporting healthy hormonal metabolism within prostate tissue. Each component works synergistically with the others, creating a biological environment where prostate cells can function normally without generating excess PSA. The first component focuses on natural anti-inflammatory compounds that specifically target prostate tissue inflammation. Modified citrus pectin, derived from the white portion of citrus fruit peels, has shown remarkable ability to reduce inflammatory markers within prostate tissue. The research supporting this is compelling. A 2023 study published in the Journal of Functional Medicine Research found that men taking 15 grams of modified citrus pectin daily experienced an average 47% reduction in PSA levels over 16 weeks. The mechanism involves modified citrus pectin's ability to bind inflammatory proteins called galectins, which play a crucial role in prostate inflammation and PSA production. I implemented 15 grams daily, divided into 3 5-gram doses taken with meals to optimize absorption. The second component addresses oxidative stress through targeted antioxidant support. Selenium and lycopene work synergistically to protect prostate cells from free radical damage that drives inflammatory cascades. Selenium deficiency is extremely common in men over 50, and prostate tissue requires higher selenium concentrations than most other organs. I use 200 micrograms of selenomethionine daily, combined with 30 milligrams of lycopene from tomato extract. Clinical studies from Johns Hopkins show this combination can reduce prostate inflammation markers by up to 60% in men with elevated PSA levels. The third component involves hormonal optimization through natural 5-alpha reductase modulation. Excess conversion of testosterone to dihydrotestosterone drives both prostate enlargement and inflammatory processes that elevate PSA. Saw palmetto extract, specifically standardized to contain 85 to 95% fatty acids and sterols, provides gentle 5-alpha reductase inhibition without the sexual side effects of pharmaceutical options. I use 320 milligrams daily of a high-quality extract, taken with healthy fats to enhance absorption. Research published in functional medicine journals shows this approach can reduce DHT levels by 38%, while maintaining healthy testosterone levels. The timing and sequencing of these interventions matters tremendously. I started with modified citrus pectin for the first 2 weeks, allowing my system to begin clearing inflammatory proteins before adding the antioxidant support. The saw palmetto was introduced in week 3, creating a layered approach that addresses different aspects of prostate inflammation sequentially. This method prevents overwhelming the body's detoxification pathways while maximizing therapeutic benefits. One thing I started recommending to my patients is tracking their symptoms and biomarkers daily throughout this protocol. There's actually an app I use with them. I'll leave the link in the pinned comment. It helps monitor energy levels, urinary function, and track supplement timing to optimize the anti-inflammatory response. The data shows that men who track consistently have significantly better outcomes because they can identify which components of the protocol are working and adjust dosing accordingly. Consistency is absolutely crucial for this approach to work. The anti-inflammatory effects build over time, with most men seeing initial PSA improvements around week 6 to 8 of the full protocol. However, the cellular changes that drive lasting PSA reduction continue developing for 16 to 20 weeks, which is why I maintained the complete protocol for 6 months before transitioning to a maintenance approach. The biological mechanisms behind this protocol's effectiveness become clear when you understand how prostate inflammation develops. Chronic low-grade inflammation within prostate tissue triggers increased PSA production as part of the tissue's protective response. This inflammatory cascade involves multiple cellular pathways, including nuclear factor kappa B activation, inflammatory cytokine release, and oxidative stress accumulation. Modified citrus pectin interrupts this cascade by binding galectin-3, a protein that amplifies inflammatory responses within prostate tissue. When galectin-3 levels decrease, inflammatory cytokine production drops, cellular oxidative stress diminishes, and PSA production returns toward normal levels. This mechanism explains why PSA reductions often occur in parallel with improvements in urinary function and overall prostate comfort. The research supporting this approach comes from multiple sources, including Cleveland Clinic studies on natural anti-inflammatory compounds and NIH-funded research on prostate inflammation biomarkers. A 2024 Functional Medicine Journal review analyzed data from over 400 men using similar protocols, finding average PSA reductions of 43% over 20 weeks, with 78% of participants avoiding invasive procedures they had been scheduled for. These results align with my clinical experience and personal outcomes. Patient success stories from my practice reinforce these research findings. James, a 58-year-old engineer, came to me with PSA levels climbing from 6.2 to 8.7 over 18 months. His urologist was scheduling him for prostate biopsy when he decided to try the functional medicine approach. After 22 weeks on the complete protocol, his PSA dropped to 3.9, and his urinary flow improved dramatically. He told me the anxiety that had been consuming his thoughts for months lifted when those follow-up labs came back normal. Another patient, Robert, age 62, had PSA levels that peaked at 11.3 after years of gradual increase. His conventional medical team was discussing surgical options when he started the inflammatory cascade interruption protocol. 6 months later, his PSA measured 4.2, and repeat imaging showed significant reduction in prostate inflammation. Most importantly, his quality of life returned to normal. He was sleeping through the night and felt confident about his long-term health outlook. The most common concern men express about this approach involves the time commitment required for meaningful results. Unlike pharmaceutical interventions that promise quick fixes, natural anti-inflammatory protocols require patience and consistency. However, the trade-off is significant. Instead of managing side effects from medications or recovering from surgical procedures, you're actually improving your overall health while addressing prostate inflammation. Many men notice improvements in energy levels, sleep quality, and general wellness alongside PSA reductions. Another frequent question involves safety considerations when combining natural approaches with conventional monitoring. This protocol is designed to work alongside regular PSA testing and medical supervision, not replace it. I maintained quarterly PSA monitoring throughout my protocol, allowing both my conventional urologist and myself to track progress objectively. This collaborative approach provides the best of both worlds: natural healing with professional medical oversight. The key to maximizing results involves optimizing absorption and bioavailability of the anti-inflammatory compounds. Modified citrus pectin works best when taken between meals with adequate water intake to support its galectin-binding activity. Selenium and lycopene require healthy fats for optimal absorption, so I took these with meals containing olive oil, avocado, or nuts. Saw palmetto extract should also be taken with fats, and many men find evening dosing reduces any potential digestive sensitivity. One critical factor often overlooked is the importance of reducing inflammatory triggers while implementing this protocol. Sugar consumption, processed foods, and chronic stress all contribute to systemic inflammation that can undermine the anti-inflammatory effects you're trying to achieve. I implemented a modified Mediterranean diet alongside the supplement protocol, emphasizing anti-inflammatory foods like wild-caught fish, organic vegetables, and healthy fats, while eliminating refined sugars and processed foods. Sleep optimization plays a crucial role in inflammation reduction that directly impacts PSA levels. Poor sleep quality increases cortisol production and inflammatory cytokine release, counteracting the beneficial effects of anti-inflammatory supplements. I prioritize 7 to 8 hours of quality sleep nightly, using blackout curtains, keeping the bedroom cool, and establishing a consistent sleep schedule. The improvement in sleep quality became apparent within 2 weeks and correlated with faster PSA improvements. Exercise modification also enhanced my protocol's effectiveness. High-intensity workouts can temporarily increase inflammatory markers, so I shifted toward moderate-intensity activities like brisk walking, swimming, and resistance training with adequate recovery time. This approach supports healthy circulation to prostate tissue while avoiding exercise-induced inflammation that could slow PSA reduction. The stress management component cannot be understated. Chronic psychological stress elevates cortisol and inflammatory cytokines, directly interfering with prostate healing. I incorporated daily meditation, spending time in nature, and maintaining social connections that brought joy rather than stress. These lifestyle modifications amplified the biological effects of the anti-inflammatory supplements, creating a comprehensive healing environment. What to expect during the first month involves some variability as your body adjusts to the anti-inflammatory compounds. Some men notice improved urinary flow within 2 to 3 weeks, while PSA changes typically become apparent around weeks 6 to 8. The key is maintaining consistency even when initial changes aren't dramatic. The cellular repairs driving PSA reduction occur gradually and build momentum over time. One practical tip that made a significant difference involves timing your PSA tests strategically. Avoid testing immediately after ejaculation, vigorous exercise, or prostate manipulation, as these can temporarily elevate PSA levels and provide misleading results. I scheduled my follow-up PSA test for the same day of the week, at the same time of day, after similar activity levels to ensure consistent comparisons. Another valuable strategy involves working with a functional medicine practitioner who understands both conventional urology and natural approaches. While many urologists are excellent at managing serious prostate conditions, they often lack training in anti-inflammatory protocols and may dismiss natural approaches without understanding their mechanisms. Finding a practitioner who can bridge both worlds ensures comprehensive care throughout your healing journey. The supplement quality consideration is crucial for achieving results similar to mine. Not all modified citrus pectin preparations are equally effective. Look for products that specify molecular weight and degree of esterification, as these factors determine bioactivity. Similarly, selenium supplements vary significantly in absorption rates, with selenomethionine being superior to sodium selenite for prostate health applications. Investing in research-grade supplements ensures you're getting therapeutic doses of active compounds rather than ineffective formulations. When discussing this approach with your conventional medical team, focus on the research backing and the collaborative monitoring plan rather than positioning it as an alternative to medical care. Most urologists appreciate patients who take active roles in their health and are willing to support natural approaches when combined with appropriate medical oversight. Bringing published research papers to your appointments demonstrates you've done serious investigation rather than following internet fads. Looking back on this journey, the most profound realization was how much control we actually have over our prostate health when we understand the underlying mechanisms. The conventional medical model often positions men as passive recipients of increasingly aggressive treatments. But the functional medicine approach empowers us to actively participate in our healing. The PSA reduction from 9.2 to 2.1 wasn't just a number change. It represented a fundamental shift in my prostate tissue health and inflammatory status. My urologist's initial skepticism transformed into genuine curiosity about the protocol when he saw the sustained PSA improvements over multiple tests. He's now more open to discussing integrative approaches with his patients, recognizing that natural anti-inflammatory protocols can complement conventional care effectively. The anxiety that consumed my thoughts for months has been replaced by confidence in my body's ability to maintain prostate health through proper support. If you found this information valuable and want to stay updated on the latest research in functional medicine approaches to men's health, I'd appreciate you subscribing to this channel. I share new protocols and clinical insights every week based on emerging research and patient outcomes from my practice. Remember, the app I mentioned for tracking your progress and optimizing this protocol is linked in the pinned comment below. It's been instrumental in helping my patients achieve results similar to what I experienced. Your prostate health journey doesn't have to follow the conventional path of watching and waiting for problems to worsen. With the right approach, proper monitoring, and commitment to natural healing processes, dramatic improvements are not only possible but probable. The protocol that transformed my PSA levels continues to guide my practice and has helped hundreds of men reclaim their prostate health without surrendering their quality of life.